I'll let you start.
All right. I think we're live now, man. What's up, Ray Lowe?
How are you, David?
Catch up with you. It's been a while.
Yeah, it's been months.
I know we're supposed to get together at HIMSS. We're supposed to have our usual fine dining with Ray Lowe. It didn't happen. What's going on? Like my family's in LA. You're obviously in LA. You're doing some incredible things. What's going on the last few weeks? Turning your head upside down.
Well, March. March was all about turning the company on a technical dime to support all the distance workers, setting up the drive-through clinic, modifying the Epic EMR, putting up clinics in parking lots that have no wireless coverage as well, and just a lot of hard technical lifting. And the last couple of weeks, AltaMed actually we're doing testing for LA City, LA County, and Orange County. So in LA City, I think there are 24 defined COVID testing sites, and we're actually running 6 of them. And one of them is on an empty lot in Boyle Heights, right behind Mariachi Square. So you can imagine putting up a mobile clinic. We see over 150 folks a day in there. It's quite the challenge, right? And we also have 4 of them in Orange County as well.
Yeah, that's incredible. And you just went live with Epic when? Summertime?
We went live on August 1st of 2019. That seems so long ago.
Did you get a raise yet? You're doing all this work?
It's got my typical annual increase.
Well, that's good stuff. So this parking lot, I mean, you're obviously expanding infrastructure and scaling out. Any new technologies you're utilizing to do that?
Well, I don't know if there's anything new. It's like, it was a tough one. It's like, I've talked to some of our other CIO friends and that vendor network you have out there.
Yeah.
We could have put a call out to a bunch of folks that could help us. And AT&T, offered some of their disaster vans because they were sitting idly. And I got notice from the COO, we need to stand up this clinic in East LA in 3 days. I'm like, how the heck? I mean, that's not enough hot spots to cover that, 4 different tents and the triaging and the mobile devices going out there. And so I reached out to my AT&T friends, and they dropped one of their mobile retail stores out there, which covered about half of the empty lot and providing the critical coverage we needed as well as power. So that was kind of a win. And then we also were doing a lot more moving from laptops actually to iPads. But again, we just went live on August 1st. So all the tools, the Haiku, the Kanto, the Rovers that are out there in the Epic suite is like we fast forwarded into doing that. But that's an operational perspective. From a continuing the digital journey, I think it was April 6th. I'm sorry, look at my calendar on the side here. That the CEO says, "Well, I want my televideo solution. I want it now."
Yeah, that's awesome. Yeah. So was it a 5G AT&T deployment where they brought out this truck, or did you look at anything with SD-WAN? I mean, that's been something I've been talking about and working with a lot of organizations on for the last few years, but it really hasn't taken off in healthcare. It's a proven technology, but was that something that's even in your mind?
Well, it is. It's part of our whole televideo, journey. The 5G is probably more pervasive as we're looking at a remote patient monitoring, for our CHF COPD. So, we're looking at 3 things right now, kind of on our digital transformation, and this is happening in weeks. Where usually it would happen in quarters. So, the first part is, actually setting up the integrated televideo solution inside of Epic, or working with Epic. And there's 3 suppliers that are out there on Epic Web that they recommend, and we just completed those negotiations yesterday with an eye to go live really in about 3 weeks. And then on top of that, we're looking at how do we improve our patient engagement, and we're looking at laying another additional application on top of our contact center. And now I'm thinking, does my contact center have the ability to support what I need to, because it's about 7 or 8 years old, so it might need an uplift, which adds more complexity. And then when you go beyond the care, right, to the patients, like what do we do for remote patient monitoring, to keep them out? And of course, we have a mobile first approach.
Yeah, that's awesome. I hope you're trying to get that stimulus, the 200 million telemedicine fund, because of the patient population you serve, you'd be the perfect candidate to receive that, and obviously be well deserved based on the needs you serve.
Yeah, thank you. Yeah, we are going after some of the care stimulus funding. A lot of the video enablement, the tele, the labor, the apps that are required for us. We have a fantastic grants department that's helping us with that. But we're also looking at, we have elder care programs called PACE, which are all-inclusive care to the elderly. They're a many type of program. So we're also looking at how do we transition, that care in there, look for grant funding in that space as well.
Yeah, no, that's great. And then another tip, I'm sure you're aware of it, but in case people are not aware of it, utilize your government affairs relationship in your healthcare organizations, because they could help drive and get that moving a little bit faster as well. So whatever you need to do in terms of getting that piece of the funding just to keep afloat, I think that'll be extremely crucial.
Absolutely, yeah. That singular focus, the COVID-19 did give us a really singular focus, as we had different competing priorities in the organization, and everybody had to align, right? Government affairs, technology, executive governance, clinical, provider, and change, and keep tuning and moving ahead. So it's been a fun ride. It's been a very fun. It's only been 6 weeks. 6 weeks.
6 weeks. So are you starting to feel like Groundhog's Day? A lot of our peers are saying, it's been 6 weeks. The first 3 weeks are just extreme
hard
change.
Yeah.
Now you get used to stabilized. Are you starting to get that sort of that point already as well?
No. So like AltaMed, Dave, you kind of hinted at it, right? So we're one of the largest community health centers in the country. We're an FQHC, and so being an FQHC, you provide care for anybody and everybody, independent of their ability to pay, and we also do managed care. And so usually community health centers are going to be a bit more backwards in terms of what they're offering or how they're offering. But, with the drop of visits that came, with COVID-19 and having a significant, drop in in-person visits, right? It's really made us be very nimble and agile, thinking about how do we still deliver the visits and provide the right quality of care, to our patients. So I wish it was Groundhog Day. I am like fulfilling my strategic plan, really in like every 2 weeks, which would have been normally, 2 or 3 months in terms of the vetting and the decision process. But, but it is fun doing that. You got to have a good physician partner as well as you're, having the conversations and synthesizing that whole puzzle together is, it's very satisfying.
So you got some pretty cool fans from our group on LinkedIn giving a shout out. Will Walders, Joe Vento, they're saying, man, raise the man. So, okay, after we get through this transition, post-COVID, what's on your mind for 2020? Or is 2020 kind of pretty much dead because you're going through sort of the ability to scale out? You're probably focused on telemedicine. IT budget may be cut because everyone's going through some sort of cost-cutting exercise.
Right. Yeah. It's interesting because I know that's right around the corner. So when I'm kind of talking about these enabling, technologies, it's not just all the technology, but there's also has to be an eye towards, your cost savings and how effectively, you're running. Where can we save costs? Because every healthcare system, despite the CARES Act and the stimulus funding, they're going to have significant losses. And how are you going to be able to address it? And IT is it's a critical function in order to enable the business. But we got to be smart on where and what we need to retire and how do we streamline our efficiencies. I'm looking at our telco costs. That's an easy one, to figure out. In terms of the cost savings, I'll probably do like some print fleet management stuff as well. But then from a quality perspective, it's we need to do better on population health. We're doing Cosmos now with Epic and joining that community, share that type of information around the COVID, et cetera. So I think, for the next quarter, it's really putting the right tools into place. And then the quarter after that, it's going to be really operationalizing them effectively and putting in those strong processes and checklists and doing things that are out there to be, deliver the right level of care.
Yeah. Well, someone's asking a question. Do we think VDI is taking a rebirth in healthcare? I don't think it's been a rebirth. I think unfortunately, it's taken off, and I wasn't sure whether it has always been a theme. What about you? VDI a big theme for you now?
Yeah, I think so. I think it's kind of a cool rebirth. I mean, I'm kind of a technologist and an app guy, so I'm kind of balanced between the two as I looked at how to build AltaMed. But there's a lot of technical debt that's out there, things that have been ignored or people like, okay, we can get around to it. And I feel for the CIOs that are reporting to a CFO, because you're treated more as a contact center. If you are, that's a great job, right? I report to the COO, which actually allows me to go over to the business side and drive kind of more, other transformation and wear the innovation hat or the digital hat, et cetera, and like even have a hand into the way the data is going to be used and visualized and the overall, executive cockpits that are being created, that we're seeing how we're managing things around there. So I think the role of the CIO, it's a great time, right? It's a really great time to be transformational, really lead. You got to take some risks that are out there, but to your point, it's a fun time, and I'm enjoying it.
No, definitely. I would say I was just talking to a big time executive search recruiter, and we were just talking about what's going to happen, and the response is lots of organizations also realize that they may not have the right individual, but they do value how important IT is. So the right individuals that have stepped up, like yourself and the other folks that we know within our community, they're going to shine. But also on the flip side, the ones that really have not been thinking forward, not been thinking ahead, they're extremely exposed right now with what's going on just because they can't react in time. So it'll be a very interesting thing just to see. Hopefully none of us are going to impact it, but the ones that have not been keeping up, I think the exposure is extremely high. All right, so last thing, 2021, what are your predictions? What are you going to be working on for AltaMed? Because you've done a lot in like 1 year.
I thought I would be doing like this remote patient monitoring thing that I'm doing now in 2021. So I'm going to be doing that in Q2 and Q3. But I think I think there could be some community connect, which is an Epic product where we can actually extend AltaMed's footprint to our IPAs and specialty care. I think we're going to have more focus again on the overall quality continuum and the value of what we're doing and how we're providing that care. But I also see a really large transition out of the traditional brick and mortar. I think that this year is you got the tools, you figure out the processes, and we refine it. And then I think next year, so much of that patient-centric care where the patient wants it will really be delivered, at one click, on your mobile device. So that's where I see a lot of our focus happening.
That's awesome. Well, there you have it. One of the top CIOs in healthcare, Ray Lowe, AltaMed. I'll be looking forward to watching what you're doing in 2021, because in the past year, just watching the work has been amazing. And let us know if we can ever help you. You have all of our numbers.
Yeah, and thanks to all my fellow CIOs out there. It's we can't do it without each other. We have to help each other. Joel, great. I'll co-facilitate any meeting you want. Aaron, dude, you keep me real. Patrick, at City of Hope, you're amazing. So thank you. And Sarah too.
All right, man. See you later.
All right. Bye.